You are now listening to Protecting Your Nest with board-certified family medicine and obesity medicine specialist Dr. Tony Hampton. For more, visit drtonyhampton.com. Welcome to Protecting Your Nest. I am excited to have with me a fellow physician who, like myself, has found the secret to reversing metabolic disease in our patients and in ourselves. So what the heck is metabolic disease? Well, to find out, I had to go to one of my favorite websites to learn more, which is the Metabolic Multiplier. So I encourage you guys to check out that website. They talked to a biochemistry expert, Richard Feynman, PhD. He actually was a previous podcast guest as well. And he showed his explanation from a biochemist perspective. Number one, metabolic health is the absence of metabolic disease. In turn, metabolic disease is defined by diseases whose symptoms can be corrected by metabolic treatment. Usually therapies are based on controlling the input, which is your diet, or the machinery, which are our body's enzymes and hormones. And if anybody knows anything about metabolic disease, it's a hormone problem, and that hormone is insulin. Increasingly, we see different diseases that respond to such approaches. But in the end, diabetes remains the perfect example of metabolic disease. I would argue obesity as well. So now let's talk a little bit about metabolic syndrome. And that's defined by the American Heart Association as occurring when a person has three or more of the following measurements. One is abdominal obesity, which is when you have a waist circumference greater than 40 in men and greater than 35 in women. And from your blood work, you can measure your triglycerides, and you want that level to be less than 150. And your so-called good cholesterol, which is your HDL, should be greater than 40 in men, or in women should be greater than 50. So, and then you have systolic blood pressure, which you want to be hopefully less than 130 over 85 or so. And then, of course, your fasting glucose should be less than 100. So these are things that we consider part of metabolic syndrome. And it's really important to understand that. So if you don't want to worry about metabolic disease, you want to hear from my guest and friend, because he is somebody you should keep in your toolkit to provide guidance and inspiration as you work towards your journey of healing. And that guest is Dr. Tro. And Dr. Tro is a board-certified physician practicing in internal and obesity medicine with a focus on putting chronic medical conditions like diabetes and hypertension into remission by implementing lifestyle and dietary changes. He himself has lost over 150 pounds and is, really helping countless patients to achieve their weight loss goals. And it's really inspiring. So he's exactly what we need in healthcare. A doc who's not afraid to take a different path when the current path is not working. And, and docs who understand that if they don't focus on lifestyle, they would really struggle to help their patients heal. And that's exactly what I learned in my practice and what Dr. Tro has learned as well. So Dr. Tro, I appreciate you taking the time. We're both in the middle of a busy clinic. We both had to sneak our mics to work so we can record this episode of Protecting Your Nest. How's things going for you today?
Everything's going great. I'm so happy to be here. I mean, we've talked so many times. You came on our podcast. We've talked about potentially doing a community event together where we'll probably talk to a church and kind of focus in on their lifestyle. So I'm excited to work on that with you. We have so many, we're both part of this new organization, the Society of Metabolic Health Practitioners.
That's right.
I mean, there's a lot of things that we're working on together, and I got to be honest with you. I'm so impressed by everything you're doing, your podcast, working within a hospital system to achieve great things, and here's the other thing, working in an underserved area, you are a role model to me. I wish I can have, the impact that you have. And, it's just, I'm happy to be here. I'm happy to call you a friend, and I'm excited to be here.
Well, I appreciate your words, and I guess we inspire each other, and I've been impressed with your journey as well. And I do want to, I guess I'll have to do a shout out to my health system. And I think that we both have colleagues who we follow on social media, and they are not able to share the message of healing through metabolic health, keto, low carb, even carnivore, because they are afraid. And I just thank Advocate Aurora for allowing me to speak my mind. And the last episode I recorded, we talked about systemic racism with one of our presidents, Rashard Johnson. And so to be in a health system where you can be comfortable being yourself and charting a different path, you have to give them credit for that. And I encourage anybody who works in the health system to nudge your health system towards that model. We all are individually created, and we all have individual ways of seeing the world. And if we're learning something different, we should have the ability to practice this craft of medicine in a way that allows us to achieve our goals. So thank you for that. And I want to start just by sharing you sharing that incredible transformation you had when you lost 150 pounds. And I really wonder, who was that guy back then who lost all that weight, before he lost all that weight. So take a moment and reflect on who you were as a person before you lost weight. And I want you to just talk a little bit about what that was like for you to just be a guy who was 150 pounds heavier.
You know what? I want to talk about that, but you brought up such an important topic that we don't get enough time to talk about. And the fact that we're both doctors, and we're both healers, and I think we have to focus in on this. And most people don't want to talk about it because it hurts. It hurts to listen. They don't want to talk about it. It hurts their feelings. It's opinionated. And that's systemic racism and systemic oppression. And you brought this up, and I just want to talk about it because it's so obvious in medical care how much there is systemic racism and systemic oppression. If you look at health outcomes in Black and Hispanic people and compare it to white people, it is demonstrably obvious to any doctor in cancer, in diabetes, in blood pressure, in stroke, in heart attacks. If you're Hispanic, you do worse. If you're African American, you do worse, right? If you're Native American, you do worse, right? And how is it that if it was just one thing, you could say, oh, maybe there's a genetic cause, right? If you could say it was just cancer, right? But we're talking about cancer. We're talking about heart disease. We're talking about diabetes. We're talking about multiple depression, every single healthcare, even infection, COVID infection, right? If you're African American or Hispanic and you get COVID, your chance of dying is like 4 to 5 times that of somebody who's white and educated. And I think, this is an opinionated topic, but at the end of the day, we are doctors and we are responsible for the sickest and the poorest people, right? That is our calling. And if we don't acknowledge that we are failing these people. Right? We are doing a big disservice to who we are, and what our calling is. And it's easy for me to talk about metabolic health, and this is why I have so much respect for you. I'm in a private practice model. It's an affluent area. We do a lot of things to try to reach out to people who can't afford us. We offer some free care. We have certain time dedicated in our clinic, but for the most part, I don't think we're doing enough to reach the minority communities around us, and that's why, I said you really inspire me, because you're doing this within a system, and you're, the fact that, just like with me, I'm somebody who lost 150 pounds, so you're going to inspire people. I could be giving the same message. Look at Brian Lenskis, my partner in the podcast, Low Carb MD podcast. He lost a little bit of weight, but we say the same exact message, but the messenger matters, right?
Yeah.
And he happens, people in the faith-based community really relate to him, but people who are 350 pounds, 400 pounds, 450 pounds, they relate to me.
Yeah.
And I know, we may be saying the same message, but we need different messengers.
Right.
And, we need the Tony Hamptons. And so that's why I'm excited to be here. I'm happy to be here. And I'm really excited to work together on a number of things coming up. So anyway, I just wanted to put that out there.
I appreciate that. And you sound very sincere, and I know you are. And I do feel a sense of, you always go back to Charles Barkley, and he says, remember his old famous, I'm not a role model. And it's like, yes, you are. It's like, yes, you are. So as an African-American in the metabolic health space, I take that on with honor. And if I can be a face that some people need to see that face. We want to live in a world where it's not necessary for you to look a certain way or be a certain way. And some of my best doctors in this clinic that I help to lead, they're some of the best doctors who see primarily African-American. They're not Black. They're phenomenal doctors. And because people can smell if you care a mile away. They can just sense it, right? But I agree with you. There are some of us who just feel more comfortable. And that's why that last podcast where we talked about systemic racism with Rashard Johnson was important, because we need to be honest about this. And people just need to be comfortable. And I really appreciate that. And I learned, even as I did my research about, how it impacts people of color, COVID, we are more prone to oxidative stress. We do tend to have cytokine storms and overreact to that in a way that our white counterparts don't. That's a reality. And that's a scientific fact based on some of the recent studies I've seen. So the reality is, when you add the social determinants of health to that, and the lack of access to care, and the fact that people are not comfortable with the history, it just makes it's a perfect storm. And so what I feel, and as you feel, let's go into the churches. Let's continue doing this work on podcasts. Let's make videos. I know you make videos as well. And let's do the best we can to just reach as many people as we can. And then if I'm blessed enough to be in a health system that will also hear my cry as we work on weight management programs, we're going to be doing that this year, then we have opportunity to maybe model what can be done in a health system around wellness. In fact, if you log into my computer, it'll say, Advocate Aurora, we help people live well. So my job as a frontline clinician is to say, well, what does that look like? It's not about just making sure, somebody has measured your hemoglobin A1C and that we have made sure you saw the ophthalmologist. It's to help people live well. And that's to prevent disease, not just live in a world where we're trying to treat it. So I really appreciate that. And again, I know that as you have taken your journey, you've probably just had some incredible moments when you said, okay, man, this is a lot different than the person I was. And, so I guess I'll go back to that. So where have you been able to see yourself differently in terms of how you perceive yourself? Because, we all have our insecurities. And people may look at me and say, you're a successful doctor, blah, blah, blah. But everybody looks in the mirror and feels insecure. So I want to better understand, what was that like for you?
Yeah, so let's stay on the topic of systemic oppression, right? So I'm a almost 400-pound doctor, 350 pounds in a very prestigious internal medicine system, in the Yale system. By the way, everybody was very nice, but look, let's be honest. Okay, obesity is highly stigmatized. right? Especially obesity in a doctor. In fact, there was a time where a patient said, why would I have that patient be my doctor? He's obese, he's overweight. Why would I listen to him if he can't even manage his own weight, right? And I'm board certified. I scored on the 90th percentile on my board exam. But this is what you face as an obese doctor. And I mean, this was my whole life. I mean, you don't even pay attention to it anymore. It's there, but you kind of just have to endure it and ride through it. I mean, I was overweight my entire life, right? Growing up, being picked on, certainly, having, just, my entire family, was picked on. The doctors would, basically tell us to eat less and move more. This is to my mom, my brothers, my dad. We were all wildly overweight, and really nobody ever told us how. They just said, do better. That's really great. That's great advice. So really, if you look at somebody with obesity, and this is, I'm speaking personally, this is a person who has tried millions of things, and nobody actually tried to help. None of my doctors actually tried to help. None of them said, here, these are foods that'll fill you up. You should focus on these. These are foods that will, leave you wanting more. You should avoid these. I went to dietitians and they, you ask them, should I eat chocolate or not? Well, they say, you can have chocolate, but just eat a little bit, and then the end result was always, all the Halloween candy was finished. Right. So, you should have cereal, these were the recommendations to me by the dietitians I saw, by the doctors I saw, that say, well, why aren't you eating less? Why aren't you exercising more? Just basically, and then, in the notes, of course it would be, patient unable to lose weight. So it was a lot of blaming me, and giving me advice that basically was a setup to fail. It's like, imagine I went to a poor community and said, why don't you guys make more money than you lose? Right? Like, it would just be so silly. Right. And, so I think, while we're on the topic of systemic oppression, really in our society, we have biases against people who are overweight.
Right.
And some of them are very overt. Like I said, somebody told me once that they didn't want me as their doctor because I was overweight. And you learn to deal with it over time. You learn to accept it maybe to some extent. And physicians, I mean, they spend on average 2 minutes less with obese patients than other patients. Right. I mean, and we don't even, most physicians have these tiny, when you go to their exam, when you go to their waiting rooms, they have these tiny chairs with narrow kind of armrests. A patient with obesity can't even sit in those chairs. Right. So nobody has really considered them, considered their emotions, considered anything about them, other than blaming them for eating too much and not exercising enough. So that's the kind of the mental space. If you're asking, where did it come from? And it was my wife. I basically, you learn to just deal with this. I mean, I'm sure, as being African American, you face, being a person of color, you face oppression and you just deal with it, right?
Just deal with it, yeah.
And everybody knows it's there. We all know it's there, and people just deal with it. I mean, there would be times where, my patients tell me now, like when people, they say fat jokes, they say, this is like an accepted, it's an accepted, prejudice, being overweight, right? So the thing is that, it never really hit me hard. I got to be honest. I am dramatizing it a little bit. I'm singling out moments that stood out, but bottom line, I was a board certified doctor. I scored in the top percentile in my board exams. I was trained by the brightest people, and I had no idea why I was overweight. I had no idea. I was eating healthy foods. And then finally my wife says, because my wife knows how to play me, she knows how to, I guess, inspire me. She knows how to work her magic. Let's just put it that way. And she says,
Mhm.
Tro, you're a smart guy. You figured out, you diagnosed, I diagnosed an issue with her dad. you you were the one who figured it out. You figured out these things with your patients. Why can't you figure out obesity? And that's when my journey really started, from being, kind of somebody who's just stuck in the system, to how the hell do I get out of the system? And how do I escape this? And so that was like a big turning point for me.
Yeah, I love it. You really shared some wonderful insights about just your just overall experience, and what it felt like. And it's almost like, I know that many of us have gotten additional training around obesity, and I don't know that I thought about the chairs in my office until I got that training. I don't think I thought about it. And even now, unrelated but similar, my medical assistant, who's wonderful, by the way, her name is Denise Avalos. And so if I have a hearing impaired person, I will ask my medical assistant to take the chair, which is a wide chair, by the way. And that chair has to be sitting right next to me in this computer. So that person, they can hear me. I'm looking right at them. They're literally right next to me. And what a simple intervention. That way they don't feel uncomfortable. I'm not having to yell across the, exam room. And did it take a lot of effort to just move the chair? But the key is that it's a wide chair, so that for my larger patients, if they need a wider chair, they have that. So I think that not only are us clinicians needing to get extra training, but health systems need to get training. And it should be incorporated. We have to do these continuing education modules. And we do talk about making sure that there's, things that are not happening in the workplace, like sexual harassment, et cetera. And we do talk about understanding other cultures, but we because obesity is a pandemic that's worse than COVID, we really need to, that should be part of that education. And not only should it be part of education, the health systems need to walk into spaces and to ask themselves, what can we do better? What if I would, and have the person who's overweight with them and say, what do you not like about this space? Listen to them and then make an intervention. So, this ideal of systemic racism is a broad one. I had a hearing impaired couple on my virtual visit schedule this week. And thankfully, we have technology for that. But we need to live in a world where they feel comfortable when they go into the local fast food. What's in place for that in that environment, so that they can order their food, even though I don't want them in a fast food. But if they are in that environment, can we do it in a way that honors and respects them? So I think we have a lot of work to do. And again, I appreciate that you're inspiring people with your message. And I'm curious, with your family, did you inspire them as well when they saw you make your transformation?
Yeah. So here I am now. I'm a, 350-pound doctor, and my wife is basically like, look, she's pregnant with her third kid, and she's like, are you going to make it? Are you going to even be alive? Can't you figure this out? And so I go back to the medical literature. I start looking into, all right, just like I treat it like a drug. All right, what drug works best? What diet works best? What makes people eat? What are the different aspects of hunger, cravings, eating, fullness? What affects all these things? And so I began to look into the literature, and it's funny. One of the studies I came across was the Faith DM trial, where they went to really underserved poor areas that have food banks, and they literally gave people, and a high amount of these people were actually minorities, and they gave them fruits, vegetables, whole grains, right, as a part of an intervention to see if it'll help them lose weight and it'll help their diabetes. And what do you think happened?
It seems like it would have helped them, at least a portion of them.
It didn't do anything. Didn't help anybody lose weight, right? It didn't help. Like, these are the most underserved people, right, who will are most likely to benefit from getting quality food.
That's
right?
crazy.
And they gave fruits, vegetables, and whole grains, and cereal, granola, etc.
Oh, Lord.
And what happened was nothing got better. So this was one of the studies I looked at. I was like, wait a second, okay? It made me really start to question what healthy is, right?
Right.
What's healthy for a person who's normal weight? It sounds great to eat some, a little bit of yogurt, have some fruit, have some potatoes and rice and quinoa and cereal and oatmeal and granola and bananas. That seems perfectly fine.
Yeah.
But the people who needed it the most, right, their diabetes was out of control, right? It didn't seem to help the diabetes or the weight loss to do these things. So it really made me start to question. And then I looked at the medical literature, even to more depth. What makes people hungry? Sugar makes people hungry. That sweet taste makes people hungry. When you eat a lot of carbohydrates, and then 3 or 4 hours later, after you eat that pizza, why are you eating the cold pizza and it tastes better?
Right.
What's making you hungry 3 or 4 hours later? Why is it after you eat Chinese food with the noodles and the egg roll that 3 or 4 hours later, it's like you could eat the cold Chinese food and taste better? What makes that happen? Right. So I started to look into this, and it's clear as day. Like, if the diets that work the best for weight loss, okay, are generally lower in carbohydrate and sugar. Right. And it's not by much. I mean, look, if you want to do a low fat diet, you can lose weight with that. It's maybe a 5-pound difference, but the best effect was with low carb diets. So I said, I'm doing that. If you have 2 antibiotics and one is 5% more effective, I want that antibiotic, right? So I started with low carb diets, again, still reading the literature. And as I read the literature, all the stuff they taught us, Tony, was you learn how wrong it was, that the whole grains and the fruits, that there's a place for them, there's certainly a place for them,
Right.
but it's not that everybody can eat everything. If you have weight to lose, eating more cereal and more, whole grain Pop-Tarts, it's not going to do you any service, in granola bars and Kind bars. It's not really going to help you lose weight. And if you have high blood sugar, having more carbohydrates doesn't necessarily help you, especially if you're not losing weight. So, and then so I started to lose weight, and eventually, after 2 years, I lost 150 pounds. And then I talked to Mom, and I'm like, Mom, you got to do a low carb diet. You got to try it out. You're diabetic. And her diabetes improves. She loses weight. My dad does it, loses weight. My older brother, loses more than 100 pounds. My younger brother loses more than 50 pounds. So we were told it's our genes, and, basically, the brunt of fat jokes for an entire life. And now all of a sudden, by reducing carbs and reducing sugar, that's getting reversed. So I brought them with me. You got to be your brother's keeper, right? I brought them with me.
I was afraid to ask the question because I wasn't sure, but I'm gonna tell you, it's so much. In fact, I'll be talking to my brother this weekend, who I've talked about these things before, but I don't want to go to a family event and spend the event trying to evangelize with my family about diet now. So I tend to let them come to me. They know what I do. And he started having other issues, and those other issues is my hook, because they're all connected to metabolic health. And I explained to him just last night. This conversation occurred, and I told him, hey, it sounds like if you work on this part of your life, those 2 or 3 things you're concerned about will be much better. So I'm really happy that you had success with your family. I'm going to try to do the same. And then when I wrote my Fix Your Diet, Fix Your Diabetes book, I literally was thinking, oh, it's going to be vegan, vegetarian, grains. And then, like you did, we were educated to look at science. And when I looked at the data, these various studies, the A to Z study, the SHI study, I'm like, well, it looks like the low carb diet is winning. Mediterranean did well as well. And I'm like, well, why would I then write a book about, being a vegan or vegetarian when and again, for the right person, it works. In fact, when you think about In Your Carb Confusion with Amy Berger and Dr. Eric Westman, I mean, they actually have a less than 20. They have a 20 to 50 carb, and then they have a 50 to 150. Now, that 150 carb individual is probably not people like me and you. They're probably that, 25-year-old who's very active and probably, can tolerate that. But for most Americans, even that number is just too high. So what we have to do is we listen to our bodies, we see how we respond, and we create a model that fits that body. And I think that's going to be the key. And I think that if we use the language of we hear you, we understand you, let me hold your hand and guide you. That's the language I want to speak. So when you're talking to patients, you probably hear a lot of wonderful success stories. I mean, just off the top of your head, or is there one story or two that has happened recently that comes to mind that you would like to share?
Yeah. So this weight loss that I kind of went through, that was like maybe 7 years ago now, where I started on this journey, and then just like you, got board certified in obesity medicine, and then when we started developing the program here about 4 or 5 years ago, and I'm in the New York City area, I said to myself, I have to undo everything that's wrong, right? So I said, first things first, every single chair is going to support 1,000 pounds, right? Our scales are going to work. Our exam tables and exam chairs, right? We have a medical recliner that people could sit on in case they can't get up on an exam table. I said, this office has to be for somebody who's 600 or more pounds. Okay. And we made everything in the office wide halls, wide doors.
Yeah.
And then I said, well, wait a second, and this is 4 years ago, I said, we have to be able to reach people who don't even want to come in. Some of these people have, who are very obese. They don't want to come into the office. So we have to be able to remotely monitor them. We have to send them scales, and it has to be scales that are bioimpedance scales, and we have to send them blood pressure cuffs, and we have to send them, a care package of foods to help them transition. We have to send them a CGM, a continuous glucose monitor. So, and we have to be able to meet them remotely. I can't just force them to come in every single time. It's not going to work. So we've been doing telemedicine and remote patient monitoring for basically 4 years now, and we have hundreds of patients now that we're monitoring their weights completely remotely. So we get to see, it's not just when they're with us, we see their weights and their blood sugars and their blood pressures for as long as they will be with us. And in terms of, so we see amazing stories every day. I mean, we post it on social media, we post it on TikTok. Obviously, we don't put identifying information, but we've had weight loss in this office of over 200 pounds. We've had over 25,000 pounds lost total, or more than that now, actually. We've had several people come off insulin. I want to say probably upwards of 20 patients come off of insulin, many patients coming off diabetes medications. But I'll tell you, there's maybe 4 great cases. We've had patients with triglycerides in the thousands that we've brought down to under 100. Okay. And we've published this in the medical literature.
Wow.
We've had patients with severe binge eating syndrome and food addiction, completely resolve. And we've published that in the literature. And what we're working on right now, Tony, we're working on 2 very important pieces of literature that we're going to put out, case series. One of them is showing that you can reverse your diabetes without any weight loss. We have a case series of 4 patients with an A1C through the roof. Basically, the A1C is the average blood sugar over 3 months, showing that they're in the range of, on average, 12. Okay, coming down to, on average, 6.
Man.
While we take them off of insulin and metformin. Okay?
It's crazy, isn't it?
And in 4 months, the average weight loss was 8 pounds. Nothing. It wasn't a lot. In fact, in one of the patients, we did not want him to lose weight. Okay, we did not want him to lose weight because for other reasons. But and people may not understand why this is important, but it's important because when you go to the ADA guidelines, the American the Diabetes Association, it says, certainly they say you can do a low carb diet. They can say you do plant-based, you can do Mediterranean, you can do low fat, you can do DASH, right? But they say it doesn't matter what diet you do. It doesn't matter what the macronutrients are. It matters if you lose weight. And so this study will be important because we're going to show people it's not about weight loss, right? Weight loss does help. Weight loss will help.
That's right.
But you can do it and have an immediate impact, come off your drugs if you lower your carbohydrates.
Yeah,
right?
And people need to hear that because I've had many patients who I say, I tell them we're measuring a lot of different things. So that one thing which they focus on, which is weight loss, is, it can mean something, but those other things that we measure, and that's why we started with metabolic health. If those things are getting better, then that means that you're getting better. And if you stay on this path and continue this journey where lifestyle is your primary focus and you're focused on you, then what happens is all the weight, if that's your goal, we'll get there. But I really appreciate that because we do need to, let people know that how we define success may vary and it may not be what you've heard in the past. So I'm totally on board with that. I actually did something unusual this week. We're recording this on a Thursday. And so I think it was on Tuesday. My medical assistant said she was going to get lunch. And that particular day, I didn't bring anything. And I tend to fast until around 1 or 2, and then I'll have something that's very low carb friendly. So I said, you know what? I haven't had a Subway in a while, right? And so I decided, let me get just a 6-inch Subway. And so I had my Subway, and it was delicious. And then about an hour later, I'm struggling to keep my eyes open. And I literally couldn't connect the dots until she said, you had a Subway sandwich, right? So I tell you, man, my body, and I think anybody listening, your body will tell you what metabolic health should look like because it'll put you to sleep if you're eating the foods that are not good for you. So we really just have to learn. And again, I appreciate you doing research so we can look at things through a different lens and then be able to say, here are the things that help people. And let's figure out what is best for you. We just feel that for most people to achieve metabolic health, you're probably going to have to restrict the carbs. So I'm really excited about that. And again, I am absolutely committed to also doing research. And with a large health system behind me, it shouldn't be that hard. It's just about deciding what to focus on. So we have people that we inspire And then there are people that inspired us. I feel, we started by saying we kind of inspire each other. And I did mention Dr. Eric Westman and Amy Berger. Amy Berger is inspiring because she wrote the Alzheimer's Antidote and gives people hope about dementia, which they never had before. Dr. Eric Westman is the guy who started research, who probably inspired you to do research. So when you think about people in the low carb community that you would maybe recommend a patient to learn from, who comes to mind for you?
Yeah, well, first of all, there's so many people. And actually just to basically the people who are really mentored me and I look up to and everything they've done had a huge impact on me. One is Dr. Eric Westman. He's really helped me. Actually, I'm not a research guy. I got no research background. I'm a doctor. I'm like a plain, straight shooting doctor, right? So I have very little research experience, but I have so much data. We have so much data in this office, so many data points, remotely monitored, blood sugar, blood pressure. I mean, the way we get labs is, very systematic. The way we track our patients' progress and their appetite is very systematic. So, we have data, but I didn't know what to do with it. And it really took the help of Eric Westman and people like David Ludwig to help me, hone in, and honestly, some medical students and residents that have put in their time and effort. Jordan McCreary, Kristen Gavadia, these are people who have come rotated in our office and really helped get these amazing things we're seeing into literature. So, and I have to be honest, Brian Lenskis, Jason Fung, really pushed me into the public sphere, with the podcast. And without them, I'd be, it'd be really different. And these people have had a huge impact in my life.
Yeah, well, thank you. I feel the same way. There's a certain group of us who are exactly the same. And I think I kind of would say myself, you, Brian, Dr. Kristen Bear, et cetera, are kind of in that category. And I'm like you, I'm just like a blue collar, just doctor. And because I'm in a large health system, I may be more comfortable doing some research with their support, but I'm just about helping people learn these principles and to do a good job, achieving their goals. So, and I think part of my job is to inspire them. So I know that I had Dr. David Unwin and Jen Unwin separately on the podcast, and I learned from them. And it probably was more grounded in what Dr. Jen Unwin taught her husband, because she was the behavioral health professional. They shared that GRIN acronym, meaning, focus on your goals, your resources, incremental change, and noticing when things are going well. And I use that to help engage patients. I think we were all doing a version of that without our knowledge, but it was nice to have something easy in my brain so as I interact with patients. So I'm curious, when you approach a patient visit with your personal experience and your perspective, how do you make sure, they walk away inspired, just enough information to get them kind of going? Because this can be a little intimidating, which is why books like, In Your Carb Confusion are written, to make it a little easier and more accessible. But what do you do in those short visits? Because when we finish talking, we got to go see patients. And, how do you how do you get that information out? And I know you have a different model now, but what do you do to make that happen?
Bottom line is we are responsible for our patients. We are collecting an immense amount of data. We make it so that we hold ourselves responsible. We want to see them improve and stay improved. We want to see them going on the right way. So we engage them, we text them, we have group meetings, we have small groups. Our meetings, they meet with us weekly for 8 weeks, when they start a program with us, and then, they go bi-weekly for a couple of months, and then they go monthly for a couple of months. So we don't do these get rich quick schemes, right? It's not like, lose 80 pounds in 14 days. We're not doing that. We care about the long haul. And so, and we have a very systematic approach. We have a stack, we call them the 5 levers, and a way that we approach weight loss and metabolic health. We have a approach to lifestyle counseling and lifestyle coaching that involves 6 major defenses. So every week, it's okay, which one of these defenses was the weakest? Which one can we build? Which one did you do well in, right? And then where are you in terms of your progression or your continuum in your lifestyle for your metabolic health? Is your carbs low enough? How is your meal frequency? Are you adding a lot of fat? Are you, exercising? Should you consider fasting? Should you consider focusing on stress and sleep? These are part of those levers. And then when it comes to the defenses, that we use to make sure a lifestyle is maintained, well, are you aware? Do you know what's making you hungry? Do you know what is driving your hunger and your appetite? Okay. And are you prepared for that? Have you gotten your replacement foods ready? Did you get your meals prepped? Do you know how to order if you need to quickly order, from somewhere, quick and convenient? Do you know, so are you prepared? Do you have a support system? Do you know that you can text us, call us if you need help, right? If it was your car and you got a flat tire, you would call for help right away. So this is your health and your life. Or are you going to reach out to us? You should, right? I'd rather reach out to you in the moment than, 10 months later when you've gained 40 pounds, right? So we have a very systematic approach, and we're always refining it.
You sound like a behavioral health professional. You sound like Dr. Jen Unwin, because you are speaking to like behaviors. It's almost like cognitive behavioral therapy. You're not usual, because most people I talk to, we speak the language of get your carbs, to a certain number. We know Dr. Eric Westman would say at 20 you pretty much guarantee success, and most people at 50 or less. But you tend to focus on hunger. So what made you focus on that? Because that's kind of dealing with the mind and all these other factors. What got you into this hunger focus?
Yeah. Look, there's 2 realms, right? There's the metabolic prescription, right? And then there's how to make that happen, right? So yeah, I'm a doctor, but just being a doctor and giving a metabolic prescription, that's great. But ultimately, I need to make sure that they're actually able to do it. So if I'm not also a coach, which I am, I'm a licensed health coach, a certified health coach. If I'm not also a coach, I'm not going to be effective. And at the end of the day, all I really care about is the patient getting where they want to be, right? And the reason why I focus on hunger, appetite, satiety, because it's a lot easier to lose weight if you're not hungry, or at least you can anticipate and understand why you're eating and why, what are the reasons you're eating. So if you have weight to lose and your sugars are out of control, right, you really have to ask yourself, why am I eating, right? What is the reason? Is it a craving? Is it a trigger? Is it a social event that's making me eat? Am I stressed out? Am I, did I not eat enough at the meal before? Is it a routine? Is my appetite just not regulated? Right? There's so many things that can drive you to eat. And if you address these things and you're not hungry, it doesn't mean you're going to lose weight, right? It's just easier to lose weight if you're not hungry.
Right. Yeah. And you're a problem solver, it sounds like. The whole premise behind this nest and rope, which is foundational for the root cause of disease and how to identify it, is you have to figure out things. And I think when we became doctors, we were trained to be problem solvers. And then we go into the real world.
Tony?
And then in practice, we're just following guidelines. Like we don't really solve problems to the extent we could. Of course, we do that for a lot of patients. But a lot of what we do is we just follow the rules, and that's not yielding the kind of results. But it sounds like you look at each individual, you try to figure out what's their barrier to success, and you kind of coach them to identify that, and then go from there. So that's really, it just makes sense, because being a problem solver, and for anybody listening, you really want a doc or advanced practice clinician who is a problem solver. So, and that doesn't mean they'll always find the answer, but you just don't want them to just kind of take things for face value. You really want them to dive a little deeper, and, as they would say, peel back that onion. Because if you don't get to I had a young lady with acne, and I did refer her to Dr. Shayna Peter, who's a functional medicine doctor who's a previous guest, because she understands, I think her book is called It's More Than Just Acne, right? So, why do you have acne at 25? And I think what we should do is we should help guide people. And one of the reasons why I'm in school still is to just to let me learn some things that I had not learned, and then use that to help people to the best of my ability. So I really think that this focus on, why are you hungry, makes a lot of sense, because it's Chicago time, it's 1 p.m. and I probably will have something, maybe, because when I finish talking to you, I'm going to go do some video visits. But the point is, I don't really get hungry. Now, if I was hungry, it would be a bigger challenge. And I don't recall from yesterday when I had that Subway, but you eat something like that, it puts you to sleep. And then like a couple hours later, you're hungry. It's just who wants to be sleeping all the time and eating all the time? It doesn't make any sense. So let me ask you a couple of quick questions. Beyond diet, what else do you find yourself focusing on with patients that will help them? Obviously, I have this nest and rope, right? So it has other elements, like it has exercise and other factors. So where do you find a lot of the conversations end up going?
Yeah, the first thing obviously is dietary composition, and trigger foods, replacement foods, and keeping the carbohydrates low. Then it's how often and reasons for eating. So that's not really diet. It's kind of like, okay, do you find yourself eating because it's 6 o'clock and you want to be with your family? Do you find yourself eating because your friends are just asking you to go out to lunch, right? So it's kind of like the behavioral and societal and external cues to eat. Are you paying attention to those, right? And then, and that's meal frequency, really addressing meal frequency, how often and why you're eating. And then it becomes, all right, what exactly are you doing to the food that you're eating, right? So are you, like I love wings, right? I can enjoy wings all just by themselves, but I'll enjoy them a lot more if I dip them in blue cheese dressing, right? I love tuna, with a little bit of mayo, but I'll love it a lot more if I make it a tuna melt, right? So, what are you adding to the foods that may make you be eating more? So once we kind of cover those, then we move on to, okay, can you implement activity and be happy about it in a way that your body feels good, right? A lot of people, when they're trying to lose weight, they'll just go kill themselves in the gym and get injured. And, it's like, okay, what activity can we put in where you do exercise without even thinking about it? Maybe walking with your wife or husband, so exercise, it's activity and exercise becomes a big thing. And then eventually, as you carve out that time, like a habit, you're developing a habit, then we get them to implement an exercise plan. So, and then, certainly it's okay, the stress and sleep are huge. Sleep deprivation will make you eat more. Your cravings will go up. Your sweet cravings will go up. Your food intake will go up. Stress will make you hungry and eat without even the self-perception of hunger. You will eat as if you're hungry when you're stressed, but you won't even actually recognize a hunger signal and a fullness signal. So are you aware of that? Are you aware of these things? These are the domains that we work on. And then, 5% of the time we're talking about drugs. for weight loss and, or bariatric surgery. But most of the time, we're spending in that domain that I just talked about. I love talking about exercise. I'm a big exerciser. I love it. Martial arts, running, yoga, rowing, lifting weights, hiking. I love it all. So I love to help patients find something that they love and implement in their life.
It's I had a flashback from last night. Last night was interesting because I had exercised. So the thing that's interesting, I don't know if you've had this experience. So after I exercise, I'm not hungry. I know it's the opposite of what you would think. I struggle to eat a hearty dinner after exercise. I have to wait a little bit. And I've heard other people say that. And I may have heard Amy Berger talk about this on one of her YouTube videos. So that's the first thing. The other thing but I wanted to make sure I got enough calories in because I'm not at a size where I'm trying not to get too thin. If you do a low carb or keto diet, you may lose weight and you have to I have to add something back to not go too far. And I've been fortunate, unlike yourself, I have not had a weight issue in my life. So I'm trying to make sure I don't get too thin. So what did I do? Exactly what you just said. I took that steak, and although A1 sauce is pretty safe, I had to I was eating a steak because I use rubs, and I was eating the steak, and I had to add the sauce to the plate to and when I started dipping the meat in the sauce, I was able to eat more. It's like an amazing thing. So everything you just said was like confirmation from what I just experienced yesterday. And so again, anybody listening, just listen to your body, get nuggets. So when you're learning and you may hear a podcast like this and only hear a couple of nuggets, but that's all you need. And then you apply those nuggets in your life and say, let me do this experiment, see what happens with me. And I love wings too. And I tend to fry my wings without the, flour because I'm trying to avoid the starch. But you're right. If I'm dipping it in something, I'll be able to eat a lot more wings. Thankfully, depending on where you are in this journey, you could probably find a fatty ranch that's made properly, and you can probably get away with that. But yeah, you have to learn these little tips. So I am curious, since we just had the holidays, how do you handle the holidays? I cheated this year because I wanted to make sure my mom felt okay because we were doing social distancing, and I just ate whatever she gave me, right? And so I cheated, if you want to call it that. But most holidays, I kind of continue my low carb experience. So what's been your process for dealing with holidays in general?
It really depends. For me, I've never been happy with myself cheating, so I just never, nobody ever said to me, oh, I ate, how I don't normally usually eat. And I gained 5 pounds and I'm so happy about what I did. It was worth it. Nobody has ever said to me, it was worth it. It's always like, why did I do that? I wish I didn't do that. Specifically, if you deal with a lot of patients with food addiction or binge eating, right, it can set them off, right? So if it's somebody like you who's able to keep it down to a problem, to keep it away from being a problem, just limited, making mom happy, go for it. A lot of people, most of the time, the people coming to me are the people where one day becomes 1 week and 1 week becomes a month and a month becomes 3 months, and they're trying to avoid us and they're not texting us back because they're ashamed. There's a lot of emotions around it. And here's the bottom line, right? There's not much you can make, and you've talked a lot about this. There's not much that you can't make low carb, right? Or a little bit healthier, right? Even if it's cookies and cakes, this is something you could easily just, make with sweetener and almond flour. And your cauliflower, I think, was it your cauliflower mac and cheese recipe that once I did? It was just, I forget what it was exactly, but it's great. It's like you can make anything, in a healthier way that supports your metabolic health. So I don't play with fire,
Yeah. And you're right. And I tend to agree with you because if I'm like a traditional meal for the holidays would tend in the past would be potato salad, mac and cheese made from, pasta, dressing with the cranberry sauce. And if you're lucky, you'd have some greens and some string beans there. So I would go to family events, and if they had one non-starchy side, I would just eat that with some meat without the sauce on it. But what I tend to do even on holidays, I'll have greens and string beans, and it could have the little turkey neck stuff in there or whatever as you cook it. And then I would make the mac and cheese cauliflower. And when you add the mac and cheese cauliflower, that becomes the most popular thing on the plate. And then all my meat doesn't have sauce. But the bottom line is that's a delicious meal, so I don't really have to cheat. And I certainly, when I was cheating on those few days, eating my mom's delicious food, I don't like the way I felt. And on the third day, I actually was hungry in the morning when I don't get hungry in the morning. It's like within a very short amount of time, your body's like, behaving differently. So it's really important that anybody listening, listen to your body. If you're a person who is metabolically healthy and you just want to celebrate the holidays and you haven't had the journey that Dr. Troy has had, or Tro, I think that that's you have to know your limitations because there is something called processed food addictions that that you need to be aware of. And Dr. Joan Iflin with the Reset community can guide you if you want to look her up. So, but there are others that I've had on my podcast who I respect, and they were carnivores, people like Amber O'Hearn, the Black Carnivore, 8A Fox, and even Dr. Kristen Bear, who's part of the podcast you guys do. So I'm just curious, what's your thought on carnivore? Have you had patients take that journey? And just how do you feel about carnivore in general?
Yeah, a lot of patients that we have are like meat and prefer to stay with meat. It's just easier to cook. You cut a steak on and cook it 3 minutes each side, or you take some hamburger patties, or let's say you're strapped for time and you just go to McDonald's and order 4 hamburger patties, or 3 grilled chicken patties or something like that. You go to the supermarket and just get some rotisserie chicken and eat it, or a couple cans of tuna. It's really, cooking up some eggs. I mean, it's just super easy, convenient, and quick. And if you like those foods, it's great. We've seen some very rarely. We had somebody who came to us on a carnivore diet, and she had bariatric surgery, and she came in with basically symptoms of scurvy, a vitamin C deficiency. I don't think it was necessarily the diet per se, because we've had a lot of patients carnivore who we've tested their vitamin C and they're completely fine even months out.
Right.
But then in her case, maybe the bariatric surgery, she literally had symptoms of it. So we do watch for that. We do watch for folate and vitamin C deficiencies. Ultimately, most of the people who go carnivore in our practice will eventually add back some vegetables or fruit. So very few remain that way. And when we see we try to advocate for them. We try to make sure that their blood cholesterols look good and their nutrients are in line. And so, but for a short period of time, no issue recommending it. It works well. Longer period of time, I think, probably most people don't need to be that strict. There are some people I've seen who they had idiopathic diarrhea. We just had a patient who went carnivore, basically had a life of, constant diarrhea, incontinence, had colonoscopies, biopsies, everything was negative. They didn't know what it was, and she suffered basically for years. And she went keto for diabetes and lost weight and went low carb. And then she's like, you know what? Let me just drop the vegetables and see what happens. And her diarrhea, this idiopathic diarrhea, just disappeared.
Just
And
disappeared.
and
Yeah.
she brought vegetables back. She's like, I'm just going to try it out. And it came back, and then she stopped it and brought it back. And basically at the end of the day, she's like, I can't do this anymore. And so we've seen some cool things. We've seen some things to make us say, let's proceed with caution. But overall, I'm very supportive.
Yeah, me too. I support the Black carnivore and others who are out there trying to spread that message. I think, like, I'm still an omnivore. I still will have vegetables. I'll be honest. I don't eat as many vegetables as I used to because I feel better about the science, and I don't have to. And there's certain vegetables that I just forced myself to eat, like Brussels sprouts. But I would always get gassy. I would always have, beano or not, it was just, so I'm like, why am I eating something that makes me feel this way? It doesn't make sense. So I just stopped eating the thing. So if I eat green beans, no problem. If I eat Brussels sprouts, problem. So I just don't eat Brussels sprouts. I mean, it's just a very simple concept, and I love that. And you're right. People with bariatric surgery, I mean, we have to do all these labs. And by the way, I want to say this out loud. So for guys like you and me who see a lot of people who are overweight, we have to do all these fancy labs and, B12 levels and folates and, iron binding capacities and all of that stuff, because you're, when you start messing around with your gastrointestinal system, it's going to definitely put you in a situation where you may not absorb nutrients. So I could see how a person who is having issues around bariatric surgery may be more prone to something like scurvy, but my experience has been the same. For the carnivores I have in my practice, they have not done poorly at all. They do very well without having to worry about vitamin C. And I think, again, for those who want to learn more about that, I would listen to the podcast I did with Amber O'Hearn, because she really has done a lot of research around the carnivore diet and how, if anything, you have all the nutrients you need through your food. But what I wanted to highlight is this idea that, I literally have maybe 5 or 6 people in the last 6 years who have had bariatric surgery. And I'm a doctor who sees a lot of people for obesity. I probably don't even have 10 people on medicines for weight loss. So I believe that both of those interventions work for the right person, but it's amazing how many people do just fine with the right coaching and the right advice about diet. And again, as you have suggested, why are you hungry? So I just want to say that you don't have to have all of those tools, but it's nice to have them in the toolkit if you need them. So having said that, I'm blessed again to work for a large health system, and I am doing my best to impact that health system. So for you, if you worked, I know you don't do that anymore, but if you were to, write the prescription for change and how we deliver healthcare in America, what would you like to see different? What would come to mind for you?
How we could just do something completely. I think find a way to better have patients, have physicians be able to more easily share their performance and their successes, so that patients know what they're getting into. Like if you go to the guy down the street who does shakes and, and meal replacements, what is the effect? Like we're trying to, in this practice here, not only like we're trying to gather all the data we need to know that we're having a good effect, and then we want to show people that. So I think, if you're a patient out there, you have so many doctors to go to, who do you know and how do you know where to go? So I think really, I wish we would become a process-oriented profession that is able to basically be accountable, to share our results, show people what we can do, what we do, because then it's not just like I'm going to go to a doctor that's accepted by my insurance. I want to go to the best doctor. I want to go to the guy that keeps getting better. I want to go to the guy that's going to go the extra mile, right? And I aspire to be that, right? That's what I want to be. I want to get better and better at what I do. And I think reminding our profession that, our knowledge can literally cure and our ignorance can literally harm. So I think really it's for our profession. Like we just need to wake them up. They've been asleep for 40 years. How do we get them awake and inspired to actually do something?
Yeah, I like that. I like that a lot. So appreciate that. And I'm thinking, I'm just curious what's on your plate. So when you think about, your last meal or, and I'm talking about the real last meal, I'm talking about, it was nice knowing you, Dr. Tro. But so what would you put on what kind of foods do you like eating?
I had like 5 eggs before I walked into the office. Full disclosure, when I'm really strapped for time and I want something to eat, I'll make a protein shake, very low carb protein shake. I like steak, fish, shrimp, chicken. There's some ethnic foods that I like, tabbouleh, and we make it without the grain. And, I always love a salad. I'll never say no to vegetables, really. I like vegetables, but basically, if you ask my heart of hearts, I'm a chocolate fiend, the ice cream fiend, the cereal fiend, So I've just replaced all those. Whenever I have a chocolate craving,
Right.
I make myself a chocolate milkshake. Whenever I have a chocolate craving, I make myself a low carb chocolate chip cookie. When I need a chocolate ice cream, I replace. I never want to battle my appetite. I always want it to be super easy. I got my way out. I just give it what it wants. I don't really fight it. And I don't end up eating that stuff often. Maybe it's like once a week or once a month, but that's what's on my plate.
I like that. I want to share this on my website. If on drtonyhampton.com, I have a link, for Diet Doctor, but the link actually takes, if you go to the bottom of the Diet Doctor link on that page, there's a link to Linda's low carb menus and recipes. And it's GENAW.com. And it's very old school looking, but if you click under like menu recipes, for example, what'll happen is you'll go to the next web page, which will show you all of these low carb ways to make a lot of the foods that you like. If you wanted to make bread low carb friendly, if you wanted to, make something that was sweet, with quotes, low carb, and including those low carb smoothies. So I'm actually on my phone looking at it right now. And if you just click on like banana berry smoothie, for example, normally I don't do a lot of bananas, but they're able to help guide you a little bit so that your carb load won't be so bad. So that's just a tool, but there's probably many others out there. Just wanted people to know that we really enjoy our food, and we just try to do the best we can to make it as keto or low carb friendly as possible. So I know we're getting to the point we're going to wrap up, and I'm curious, as a kind of second to last question, I've had guests on my podcast, like I mentioned, Dr. Shayna Peter, who wrote the acne book, and they really understand root causes of disease. But if you think about our colleagues, and I love let me just say this, everybody out here trying to deliver care, for the most part, they really care and want to do the best job possible, but they're just trained to manage disease. So how do we, more docs are just not using this root cause approach. And, I guess we just continue to educate them like we're doing here. But what do you think are ways we can reach more docs so they'll understand that some of what you're doing is not working? Your patients are still not getting better. Let's look at it a different way. What do you think we need to do to make that better out there for our clinicians?
Yeah, like being able to switch up the approach and kind of be flexible, you mean, or being
Yeah,
persistent,
just yeah,
I think
yeah, just yeah, exactly.
bottom line, we have to have empathy too, right? If you're that patient struggling, what would you have wanted? That's a lot of how I, coordinate my practice. If you were a
Yeah,
patient struggling, what would you have wanted? And I would have wanted
yeah,
my doctor to tell me what foods to eat, be able to ship them to me, recommend different things I could quickly buy it, give me recipes, give me quick ways to manage my appetite and manage my eating, you know, guide me through it, be available, monitor me remotely, not make me come to the office. I think bottom line is our profession needs to be resilient and empathetic and persistent. And that's kind of how I live my life, Tony. I just want to, I want to know that it's done everything.
I like that, and is being just putting yourself in the uh, or seeing the world through the lens of a patient is definitely the best way to get people to um, say, well, what it's just, as I think about that, that's how I wrote my first book. You get a family member who's ill, and you're like, they don't want to be on medicine. Why didn't I do that with my patients 14 years before that? And then I had to do the research that led to me saying there is another way. But it took something happening in my personal life for me to change. So that's a phenomenal way to kind of wrap things up. So as it relates to the Nest and Rope acronym, which is focusing on the root cause, I want you to think about, well, what are you going to be focused on for 2021? Rather, it's nutrition, exercise, less stress, more sleep, avoiding trauma, how we think, having relationships that serve us, avoiding harmful organisms and pollutants, protecting our emotions, and obviously having life experiences that serve us. Where are you going to focus your attention over the next year?
Decrease stress and we got a lot of and just focus on my goals. Really focus on my goals. Stay true to
Yeah,
my goals. You see as a doctor, there's so many distractions and so many things you can get bogged down by. But just staying true to my patients and focusing on getting better and my vision. I think that's my thing for 2021.
absolutely. I love that. And I really appreciate you. And I was excited about us having this conversation. I'll probably get Brian on here at some point because I've already talked to Dr. Christian Bear and eventually Dr. Fong and others who you guys are partnering with. So thank you for all of that. Any final takeaways? And make sure people know how to find you also.
Yeah, drtro.com, spelled out doctortro.com, and social media, it's Dr. Tro, spelled out on all the platforms, Instagram, Twitter, Facebook, TikTok. I'm forgetting another one, YouTube. We're everywhere.
That's
And
right.
the Low Carb MD. I have to mention the Low Carb MD podcast. 150 episodes in. I mean, it's been such a wild ride. Yeah, just happy to be here, Tony, and happy to call you a friend. And I really look forward to working together. We've talked about some projects, and I really hope we get that off the ground.
Okay, that's it. Well, thank you, my friend, and appreciate you. And we will continue to. I look forward to us doing that church event, whether it's virtual and when hopefully in person at some point. But you will have me as a partner for life. I'm really excited about my low carb brothers and sisters who we're doing this work together with. So very excited about that. So thank you very much, my friend, and I'll just wrap up by saying that we learned a little about metabolic health today and was inspired by a great doctor. He shared a part of himself, and I hope his story will inspire you on your transformational journey as well. We are all in this together and have the same struggles, but with a little knowledge and inspiration, there is so much we can achieve. So as you enter your second month of 2021, I only ask you do the following: set some goals, be comfortable with incremental change, and promise yourself to make 2021 your best year ever. I am confident that if you just get started right away, success will be right around the corner. So as we conclude, I ask you to continue to be safe, be well, and continue to protect your nest. You've been listening to Protecting Your Nest with Dr. Tony Hampton. For more, visit drtonyhampton.com.